This chart shows the leading causes of death in the United States. Heart disease and cancer take the top two spots. But the bar that slots in right behind them, the third leading cause of death, is medical error. That translates to over 250,000 people dying every single year. If 250,000 people are dying from this annually, why isn't there a massive public effort to address it? Why is a failure rate this high treated as a footnote rather than a crisis? Part of the problem is how we track mortality. The World Health Organization uses ICD codes, a standardized list that every modern country uses to classify specific diseases and organ failures on death certificates. But look at the bottom of this list. There is no code for human or systemic medical error. Our administrative systems do not measure it, rendering those 250,000 deaths invisible to the official data. Throughout history, the most lethal threats to human survival haven't always been incurable diseases. Often, they are the measurement blind spots of the medical establishment itself. In 19th century Victorian operating theaters, surgeons worked in chaotic, crowded rooms, performing procedures in their everyday street clothes while spectators watched from the stands. Surgeon Robert Liston was a star of this era, famous for his speed. In one legendary surgery, he worked so fast he accidentally amputated his assistant's fingers and slashed a spectator's coat. The patient and assistant died of infection, and the spectator died of shock. It is the only recorded surgery with a 300% mortality rate. At the time, doctors believed in miasma, the assumption that foul air was the sole cause of infection. Because they couldn't see germs, they assumed their own physical contact with the patient didn't matter. This assumption turned filth into a status symbol. Surgeons treated blood-caked coats and unwashed tools as proud badges of honor, visual proof of their years of experience on the front lines. When Joseph Lister discovered that antiseptic cleaning could stop these deaths, the medical establishment fought him. They relied on the social belief that a gentleman's hands were inherently clean. Liston and his peers weren't failing because they lacked skill. They were killing patients because their social standards made it impossible to see the microscopic truth. This habit of choosing a convenient story over a physical reality is best seen in the case of Phineas Gage. In 1848, a blasting accident drove a 13-pound iron rod through his skull, destroying much of his brain's left frontal lobe. Most textbooks teach a specific version of this story, that the injury turned Gage into a drunken, irresponsible, and immoral man who could never hold a job again. Being a misfit, Gage achieved a remarkable social recovery. His broken mind survived because Gage became a Rorschach inkblot for researchers. Scientists saw what they wanted to see to support their specific theories about brain function. Doctors ignored the objective evidence of his recovery, choosing instead to exaggerate his negative symptoms because a damaged Gage was more useful to their academic arguments. When the medical establishment becomes attached to a theory, they will distort the facts to fit those beliefs, erasing the human reality of the patient in the process. Gage's recovery was ignored because it didn't fit the expected story. And right now, we are repeating that same mistake with a different kind of invisible killer. We still have that missing ICD code from Act 1. We are still choosing to ignore 250,000 deaths simply because our administrative systems aren't designed to count them. This cultural blind spot is even more obvious in how we treat sleep. Society has normalized chronic exhaustion, treating it as an inevitable part of a high-functioning life. We view the grind, working on 4 hours of sleep, as a badge of honor. It is the modern version of the Victorian surgeon's blood-stained apron, a dangerous health hazard repackaged as a sign of dedication. The data shows this isn't just about feeling tired. The cognitive impairment of sleep deprivation matches the impairment of a rising blood alcohol level. Drowsy driving is as lethal as drunk driving, and lack of sleep directly increases the risk of cancer and Alzheimer's. It is 11 times more likely to have no impact at all. Your body simply cannot create the antibodies. Sleep is the baseline requirement for immune function and toxin removal. It is a biological imperative our culture is pretending we can work around. Lasting medical progress relies on the humility to challenge accepted wisdom. We must update our systems to measure what we are currently choosing to ignore before our own assumptions become our deadliest disease.